Good evening, everyone. My name is Dr. Bakhtar Ahmad. I am the founder of The Medic Life, and welcome to the admissions workshop. So I love starting my talks off like this with a small introduction, also a slide. It's not a quote by myself. It's just a quote I saw a long time ago. Someday you'll introduce yourself as Doctor. It's just so powerful, and I get to do that now. I've been doing so for quite a few years because I've been a doctor for about 7 years now, and it is just as special every single time. And these are just some of the messages from last year's cohort who are actually all in medical and dental school right now, and hopefully, fingers crossed, if all goes well, this will be you guys next year. Can I get you guys to use the react feature? Thumbs up if you can hear me all good, if you can see me okay. Yep, perfect. That's it. There's a lot of you guys. There's 542, and already we're hitting a huge number, which is fantastic. And because there's so many of you guys, I'm going to do a short quiz in just a second, but I just want to talk you through about what we are going to be covering today. Okay, so obviously you're here at the How to Get into Medical or Dental School Admissions workshop. This is, first of all, congratulations to all of you guys, because clearly you guys are the keen beans who are passionate about medical or dental school, and that's why you're here today. Otherwise, why would you be here on a random Wednesday evening? It's because you're passionate about medical or dental school. And I'm going to tell you a little bit about the Medic Life, tell you a little bit about myself, but first of all, what are we going to be covering over the next hour and a half, 2 hours? Okay, so we're going to talk about what the next 12 months look like for you. We're going to talk about how to successfully apply to medical and dental school. We're going to talk about the UCAT, which is the notorious exam, right? No one loves the UCAT, but we're going to talk about it. We're going to make you guys enjoy the UCAT. It's a difficult task, but we're going to try and do it. And then we're going to talk about work experience. And by the end of today, you're going to know what the next 12 months look like. You're going to know how to apply for medical or dental school. You're going to know what to do, how to deal with the UCAT. And you're going to have some work experience by the end of this evening, right? So that's going to be fantastic. And we're going to talk about our work experience workshop, which is on the 22nd of Feb at KCL. So we're going to touch upon that as well. I'm going to tell you a little bit more myself. The whole point of this workshop is not just a boring lecture giving you some dates that you can find off the internet and blah, blah, blah. The whole point is the Medic Life is a bit of a community, right? And we want to support you with your entire application. And not just that, we want to make it interesting, we want to make it exciting, and we want to make you feel part of this Medic Life community that we've got, which we've had for many, many years. And a lot of the people that we've taught in the past now, come and support some of the events, their interviews and so on. And it's this journey that we just love to join and go through. So this is a picture of me right there, right? Not very recognizable because my hair's moved from my head to my face now, but that's me, right? And I went to Tiffin Boys in Southwest London. So those of you here from Tiffin Boys or Tiffin Girls, shout out to you guys. But yeah, this was my friends and I. This is a picture from us on the last day of sixth form. And we were, so us guys down here and these guys, we applied for medicine and dentistry, 5 of us, right? And in the first application cycle, we all did really, really well. We got our A's and A stars at GCSE, which is equivalent to 8s and 9s. We got predicted A's and A stars at A levels. We all had like really good UCAT scores. But out of the 5 of us that applied for medical or dental school, only 1 got in, right? And it's not because of our grades, and it wasn't because of our UCAT. It was just because we lacked an amount of stuff that you need to know when it comes to all the hurdles that we have to pass and you guys have to pass, right? So a lot of us ended up having to take gap years, and therefore we went forwards taking those gap years and trying to figure out ways on what to do and how to apply successfully. I then ended up working as a donor carer during my gap year in a blood donation center. And then eventually I got really, really good at just taking blood from people. And what I thought was a bit of a failure, not getting into med school the first time around, ended up being one of my greatest strengths. I now work as an emergency medicine doctor, and I am a pro when it comes to taking blood. So even in my department, people just know, my other colleagues know, the nurses know that if someone is really difficult to bleed, people have been poking them with a cannula or a needle multiple times and they still can't get their blood, they come to me. Right. And then I can just go and just get it, because that's what I used to do for a whole year, just full time. Okay. And eventually I got myself into Queen Mary University of London, which was called Barts in London at the time. And that was just fantastic. I had multiple offers the second time I applied because I'd learned from my mistakes. And that's exactly what the Medic Life is all about, to prevent you guys from making those same mistakes. After a few years, I intercalated with the London's air ambulance. So intercalation is when you take a year out and you basically spend a year doing something that excites you. And for me, that is emergency medicine, especially trauma in emergency medicine. So that red helicopter, those of you in London, you may have seen that red helicopter flying around. That's the London's air ambulance. Okay. The idea is they take the hospital to the patient. So I did a year with them. And then I applied for a fellowship, which I was very fortunate. Out of a cohort of about 450, I got picked to basically go abroad to South Africa and America for 3 months in my final year, just to do more emergency and trauma medicine, more helicopter stuff. It was fantastic. And then I graduated from Queen Mary University of London in 2019. And those of you who apply to Queen Mary and go to Queen Mary, If you know what this building is, St. Paul's Cathedral, that's where you graduate. It is epic, right? It is absolutely awesome. And then I started working as a doctor since 2019. And as I graduated, that's when I officially launched the Medic Life. Now, I was helping people with the applications beforehand anyways, but I officially launched the Medic Life as I graduated. And this is my first ever class, right? We've come so far. 5 people in that first ever class to 600 of you guys on this workshop today. So we've come a long way, right? But the reason I really love this picture is there is Charlotte, okay? And Charlotte and I worked in the same A&E department just a few months ago, right? So we were doing a shift together. It was one of the busiest shifts ever. And this is exactly what I mean about the Medic Life community, right? We work with people. The dream is that all of you guys go through medical dental school and we end up working together as colleagues. That is what it's all about. Then, unfortunately, COVID hit, so everything had to move online, which also gave us an opportunity to just expand what we can do, which is, workshops like today. There's no lecture theatre that I'm aware of where I could host 600 of you guys. And I'm sure a lot of you guys are just chilling in your PJs, and then it just makes it more accessible. So I'm glad that we can do things online as well and just allow us to help as many people as possible. This is the emergency medicine team that I work with in the south of England. And then finally, for those of you guys, again, who don't know me very well, but the whole point is that you'll get to know me and the Medic Life and our team as the year goes on. These are my brothers. So I am one of 4 boys in the family, and we are all doctors, right? So I'm the second oldest. That's me. I'm an emergency medicine doctor, also founder of Medic Life. And we've got Waleed. He has just graduated as a foundation year 1 doctor. Umar is a medical registrar, and then Blaz, the big boss, he's the A&E consultant, right? So he's also in emergency medicine. So the 4 of us obviously help people support their applications too. And we've got a big team. And the whole point is that we did it. We found our ways of doing it, and we just want to help as many of you guys get there too. So last year was awesome. 2025 was the biggest year that we did a huge number of things, and it's looking like 2026 is going to be even more awesome. So last year we did 2 work experience workshops. We did lots of these kind of workshops, the medical and dental school admissions workshops. So we do a lot of free stuff, and then we have some paid courses as well, like our UCAT courses and then our interview courses. Now these are super popular. Like I said, we're the only organization out there that give money back guarantees with our courses that we run, because I am so sick and tired of companies that will take your money, support you a little bit, not give you the right support and help. And applying to medical and dental school is competitive, right? And if things go wrong, they're nowhere to be found. Whereas we put our money where our mouth is. And with our interview courses especially, we have a 98.6% success rate of getting offers, which is just amazing. And with our UCAT courses as well, the whole point is that we want to help you get the best UCAT score and then apply strategically so you get interviews. More on that later. So yeah, this is what the next few months will look like for you, but just a little snapshot of some of the students we worked with over just the last 2 months. Just the last 2 to 3 months, these are some of the interview course guys that we came across, and we kind of help support with the applications. And the little short clip I played you at the beginning with offers, I'm already getting these messages now. So it is just amazing to see. And fingers crossed this will be you guys next year. So coming back to you guys, what do the next 12 months, 18 months almost look like for you? All right. So this is us now in February 2026. Most of you guys today here are in year 12, which means that you're going to be applying for medical and dental school this summer, and you're going to be starting medical and dental school next summer 2027. And there's loads of things between now and then that we need to just absolutely master and make sure that we get through together, right? The first one is work experience. So more than 60% of you guys answered in the poll earlier that you haven't had any work experience so far. You guys need to start acting on that ASAP, okay? Most universities understand that work experience is really difficult to get, and therefore just sending loads of emails to hospitals, GP practices, dental practices, care homes and things like that is a good place to begin. You can do volunteering roles at care homes. You can go shadow doctors. You can shadow pharmacies, things like that, right? So work experience is important. But why is work experience so important, and how do you actually use it? This is something people lack, right? And everyone could, I get so many messages. People come to me like, oh yeah, I've got 3 weeks in a surgical ward. I've got experience in observing neurosurgery. That's all well and good. But if you didn't learn anything, and if you can't reflect on it, it's pointless, right? So what I need you guys to do is every time you have any form of work experience, I need you guys to have a really clear understanding as to what was so good about it. Why did it make you want to do medicine or dentistry more? Did you come across any challenges that doctors and dentists face, and how would you deal with those challenges? Right, guys, make some notes on those kind of questions, because these are common interview questions, and also things that you should be exploring in your personal statement. Okay, so something for you guys to think about as well. Okay. Now, like I said, we're gonna go through work experience today, and here's a picture, a really badass picture of us guys from my hospital that I used to work in. This is a few years ago. So when COVID hit, we realized that work experience was going to be such an issue for a lot of people, right? So what we did is I got a few of my friends. So we got Maya over here, Vic, Emily, and then myself. So we were 4 doctors. We used to work in the same team, and we were like, you know what, guys, let's do something for people who are struggling with work experience. So we borrowed the simulation suite in our hospital, and we basically recorded what happens when a patient becomes unwell, deteriorates, and goes into cardiac arrest. Now, I myself never actually saw cardiac arrest before I got into med school, and even during medical school, I didn't see one until my final year. So the fact that you guys today are going to get an experience where we show you how to deal with a cardiac arrest situation, that is going to be super, super, super important for you. Okay, so let's go to this screen. Can you guys give me some thumbs up if you can hear this okay? Hi, my name is Bak. I'm one of the doctors. What's been going on here?
Hi, Bak. So we've got...
Amazing. Perfect. So you guys can hear this okay. You can see it all good. So just a little bit of a kind of introduction to what this is. Okay, so I've got me coming into the scene. So the way it works with doctors, right, is an on-call shift. Let's say this is a night shift. And interestingly, actually, before we recorded this, a week before we recorded this, Vic and I, we were on a night shift together. And we got called to a really unwell patient who did go into cardiac arrest. So and in this video, Vic is playing the role of a nurse who's looking after this patient, Sam. Now, Sam is getting unwell. And the way nurses observe patients is by doing observations, just by their clinical acumen and so on. But observations is one of the most important things. Okay, so on the bottom right, you can see here some numbers. So the 96, the green number is the heart rate. The yellow number is the oxygen saturations, okay? And then there's a few other numbers you don't need to worry about too much. And then the bottom left is a bit blurry, but you can see it says 88/50. That's the blood pressure. And there's a few other things that we look at, okay? And all of those together get recorded on what we call the NEWS chart. NEWS stands for National Early Warning Score, right? And it's a chart or electronic version of the chart, and that's how we monitor patients, however often we do those observations. So in this case, Sam has been getting more and more unwell. His numbers are going up. The higher the number, the worse it is, right? And therefore, the nurse has been like, you know what, we need a doctor review. So they've bleeped me. I've come onto the ward, and this is how we observe a patient. Hi, my name is Bak. I'm one of the doctors. What's been going on here?
Hi, Bak. So we've got Sam. He's a 34-year-old gentleman that came in earlier this morning with cellulitis on his right leg.
Okay.
They prescribed some antibiotics, and we've just hung those up.
Right.
But he's getting a bit unwell, so he's using an 8 now. His rests have gone up. His SATs have dropped slightly.
Fine.
He's a bit more tachycardic, and his blood pressure's a bit lower.
Yeah, I can see his blood pressure's 88/50, so not great. And his saturations are quite low. Right. So imagine you're on the ward. Okay. So you're shadowing. This could be a in-person work experience. You're on the ward. Let's say you were shadowing me. I'm like, come on, let's go see this patient. So you're just standing in the corner because you're not going to do anything because, you're not clinically experienced, but you're just going to watch. So this is the same situation. You're just observing. All right. And this is where you can take notes. You can think about the communication that's happening between the different team members. You can think about how the doctor is speaking to the patient, even though the patient's a dummy, but still, right? So a little quiz is coming up for you guys. So we're going to go this way. And how would you assess an unwell patient? What do you think? So we've got Sam, who's an unwell patient. I'm going to launch this quiz. So would you read through all the notes first? Would you watch and wait? Would you do something called ABCDE? Or would you call for senior support straight away? What do you think you would do? You've got 10 seconds to answer that. Right, 5, 4, 3, 2, 1. We're going to end the poll there. Okay, so 37% of you guys are saying you would read through all the notes first. 7% are saying watch and wait, just see what happens to Sam. 32%, so the second most popular option is ABCDE, and then D, which is call for senior support straight away. So the reason you don't want to call for senior support straight away is because you haven't assessed the patient yourself first. You're also a doctor. Remember, this is from my perspective as the resident doctor who's gone to see the patient. So I need to see the patient first to understand what's going on. Then, if I need to, I can escalate. Read through all the notes first. What if Sam's already in cardiac arrest? right? Reading the notes would waste time, wouldn't it? So you want to, and watch and wait, there's very few times when you want to watch and wait. Okay, so the actual correct answer is A, B, C, D, E. Well done to all of you guys who did that. Again, not expecting you to know these things, but the fact that some of you knew it already is a good shout. Okay, so we're going to go back to the video. I'm going to show you what A, B, C, D, E stands for and what it looks like. So it stands for airways, so we're breathing, circulation, so everything to do with the heart, disability, that is your neurological disability, not physical disability, and E is just like exposure, everything else. So let's have a look at that. Why don't we go ahead and pop him on a non-rebreathe mask with 50 litres of oxygen. Sam, hello, my name's Back. I'm one of the doctors. Just come to see how you're doing.
Hello, Doc.
How are you feeling at the moment?
Yeah, not too good.
Okay, we're just going to give you some oxygen with this mask, Sam, so just try and breathe through your mouth, and then we'll help you with getting oxygen to your lungs. I'm just going to go ahead and assess you, all right? I'm just going to remove your gown.
Okay.
Okay. So we've already assessed A, airway. The way I did that is just say, hey, how are you doing? He's like, what's your name? He's like, Sam, how you doing? I'm not too good. So the patient's talking. Now, A, B, C, D, E is structured in that manner because that's the order which things can kill you. So if you're choking, you're going to die pretty quickly, right? So we need to make sure that we can fix that. So if someone's talking, it means that airway is good. Then we move on to B, which is breathing. We've already seen that on the monitor, it says 85 as a yellow number. Your oxygen saturation should be 96% or above, as close to 100% as possible. So we need to give him oxygen. We also need to listen to his lungs and so on. So that's what we're going to do now. Antibiotics are we giving?
So we gave him some flucloxacillin.
Okay, fine. And that's still running. I can see. Okie dokie. I'm just going to have a listen to your chest, Sam. Okay, I can hear just some upper respiratory sounds. Fine. Vic, let's try and get a cannula. So we've done B now as well. We've given him some oxygen. His oxygen saturation will slowly improve, hopefully, with that oxygen. So A is done, B is done. We're now going to move to C, which is circulation. Now, circulation is everything to do with the heart, your heart rate, your blood pressure, how much fluid you need and things like that, okay? And it also means that this is an opportunity for us to maybe put some lines into the patient to give them drugs through the IV line or fluids or so on. So there's quite a few different things we can do. In his arm, please. Sure. We'll give him 500 milliliter stat over 5 to 10 minutes actually. And let's get some bloods and a gas as well if we can. Yep. I'm just going to go ahead and check your capillary refill time, Sam. So 1, 2, 1. So what I'm doing there is something called capillary refill time. This is something you can all try at home right now. So if you grab one of your fingers, right? Squeeze the nail bed really tightly. And we do this for 5 seconds. 1, 2, 3, 4, 5. And when you let go, your nail bed will be very pale and it will slowly become pink again. Do it a few times, you'll see it, right? And and we basically measure how long it takes for the nail bed to become pink again. And that's a good indication as to how well the patient is doing. If it takes ages to become pink again, and this might happen if you're really, really cold, right? It means that the blood flow to the end of your arms and therefore just blood flow generally is not very good. If it becomes pink very quickly, it means blood flow to the rest of your body is pretty good. So that's a simple thing we can do. Yeah, so his cap refill time's a bit delayed as well, so he might be just a bit low on the fluid and maybe a bit of sepsis going on at the moment is what I'm thinking. Sam, can you just go ahead and squeeze my fingers for me? Right, thank you very much. And his eyes are open. And Sam was talking to me earlier, so I'm just going to go ahead and say that's GCS 15. So what we're doing there, asking Sam to do a few things like squeeze my fingers, stick out your tongue is another one you can do. See if the patient's eyes are open or that they're looking around or if they're just like staring at a blank spot. And then whether the patient's talking, mumbling, making weird sorting sounds or whatever, that all gives me an indication of how the patient is doing neurologically as well. And Sam's doing okay from that point of view. Thank you for that cannula. And have you any pain in your tummy at all?
No.
No? Okie dokie. Let's have a look at that cellulitic leg then on this side. Let's expose you fully. So when I walked into the room, Vic kind of said, this patient is coming with something called cellulitis. Cellulitis is an infection of the skin, and he's been getting some IV antibiotics. The IV antibiotics he's getting is called flucloxacillin, and he's then been getting worse. Okay, so he should be getting better, but he's getting worse, and that's why I was called. So we're looking at the leg, and one of the things we do when someone comes in with cellulitis is basically your skin goes red, and we draw around the skin with a marker. And if the infection is growing outside of that marker, it tells us it's getting worse. If it's getting smaller, that's good, right? So in this case,
yeah, so there's obvious marked area of cellulitis. It's actually extending beyond what we had marked earlier. I'm just going to have a quick look at Sam's notes.
But now we've examined the patient, now would be a good idea to look at the notes, see what's been done by the day team, and see what more we can do.
So here we've got an allergy. Just to confirm, Sam, are you allergic to anything at all?
Yeah, I think I'm allergic to penicillins.
You're allergic to penicillin, are you?
Yeah.
Right. So Sam is allergic to penicillin. He's been getting a drug called flucloxacillin. They sound pretty similar, don't they? So what would you do at this stage? Another poll coming up your way. There we go. Go ahead and vote for me, please. Would you A, stop the flucloxacillin immediately? Would you continue it until you find an alternative because we need to fix his infection? Would you discuss with the microbiology team, who are the people that talk about, complicated antibiotics and infections, or would you give an antidote? What do we think? I'm going to give you guys another 5 seconds. 5, 4, 3, 2, 1, and we're going to end the poll there. So 51% of you guys are saying A, stop the flucloxacillin immediately. Well done. Okay, that's the correct answer. And then a small percentage of you guys saying other things. Now, let me use an analogy. Okay, I'm sure in a class of 630 something people, we've probably got some of you guys who have got the most common allergy out there, which is a nut allergy, right? Let's say you are just walking around and you're like, oh, nice cookie. Let me take a bite of this cookie, right? And then you realize, oh my God, it's got nuts in it. What are you going to do? Are you going to keep munching on that cookie as you go and find your EpiPen, or are you going to chuck that cookie away and then go and get the treatment? So you're going to get rid of it first, aren't you? Right? So that's why you stop the allergen, whatever it is that's causing the allergy, and then you go and find your, call an ambulance, get an EpiPen, whatever you need to do. So in this case, we stop the flucloxacillin, and then we think about, okay, how are we going to manage this?
Vic, can we just stop the fluclox?
Sure.
Sam, I can see a bit of a rash actually on your sides as well. And I think that you've been having penicillin in the medication that we've given you.
Oh, crikey, doctor, I shouldn't.
Yeah, so we're going to stop that. I think we're going to just keep a close eye on you just to make sure you don't deteriorate any further.
I'm feeling quite hot.
Yeah, right. How's your tongue at the moment? Do you feel like it's a bit swollen? Sam?
Right. So Sam said, I'm feeling quite hot. And all of a sudden, he's just stopped talking to me. Okay. I can imagine that even though you guys are not doctors yet, you can imagine that this is not a good sign, is it? It's a pretty bad sign. So another question I have for you guys is, what do we do when a patient becomes unresponsive? So I'm going to put the quiz up here. Give me a second. And we're going to relaunch the poll. There we go. Go for it. So what would you do? So would you start CPR straight away? Would you call the cardiac arrest team? Would you do nothing and be like, Sam's just having a nap, he's going to come back around again? Or would you look, listen, and feel? Okay. Again, being most of you guys being year 12s, I don't imagine you guys to have proper life support training yet, but just that's something for you guys to think about. Right. Give you another 2-3 seconds, and we're going to end the poll here. So thank you very much for answering. So 29% of you guys want to just jump on Sam's chest and start CPR, right? I mean, I did say earlier that we're going to do a cardiac arrest talk, right? So maybe that is what you're thinking. 10% of you guys want to call the cardiac arrest team. I'm glad that no one wants to do nothing, because there's, again, doing nothing is something that is only correct in a very rare situation. And then finally, 61% of you guys want to do look, listen, and feel. So well done, those of you guys who want to look, listen, and feel. So let's have a think about, what are we looking, listening, and feeling for? Now, if you start CPR straight away, and this is a funny story for you guys, right? A few years ago, a patient, a lovely 80-something-year-old sweet lady, came into my emergency department, and she got brought in by paramedics because she went to church. Oh no, she went out on a day out walking with her friend for quite a long day, and then she went to church. And bless her, she got tired from all the walking when she was at church, right? So then she just fell asleep. Now, the way this lady sleeps is she kind of has her head back and she just has her mouth open, eyes closed, right? So everyone thinking, oh no, this poor old lady, that's her time, she's gone. And then they got really scared, called an ambulance without actually first checking if she's just having a nap or if she's actually in cardiac arrest. So then the paramedics came, they shook her, and she just woke up. She's like, what? But then they had to bring her to emergency department. So basically my treatment for her was, I gave her a nice cup of tea and a biscuit, and I was like, have a lovely rest of your evening. So that's why you always want to check first if the patient, actually is truly unresponsive. So the way you do that is, for 10 seconds, ideally, you look at their chest to see if it's rising as they breathe. You're listening for breath sounds, and you get quite close to them so you can feel the air from their nose or their mouth touching your cheek as well. Sam's wearing a oxygen mask at the moment, so that's going to be a bit tricky, but you do it anyway, right? And you can also feel for the carotid pulse, which is in your neck. So I'm going to do all those things right now.
Sam, can you hear me all right?
And after doing it for about 10 seconds, and you've identified that the patient is truly unresponsive, not breathing, there's no pulse, then you can start CPR.
Right, Vic, he's unresponsive. So can we please put our 222 call?
Sure.
And ask for our adult cardiac arrest team to come over to this ward, please.
Can I put out a cardiac arrest call for an adult in AMU?
All we've done, I've started CPR. We've called for the cardiac arrest team because we need more people, we need more hands. There's a lot of stuff that we're going to be doing. And what you're going to see now, remember, this is what I was telling you. I didn't see this until final year of med school. You guys are already basically flies on the wall. You're seeing how a cardiac arrest situation develops, how different members of the team kind of come at it. So when you get asked about these things like, what kind of communication skills have you observed doctors to have? You're going to see examples in the next 5 minutes that you can talk about at your interviews in a few months' time or in your personal statements. How do doctors work in a team? Tell me about a time that you've seen a doctor display leadership skills. How do doctors deal with stressful situations? All of that stuff you're getting from this. So make sure you're making some notes, right? But just before we go on to that, another quick question. And the question is, brownie points for those of you guys who get this right. What is the ratio of CPR to breaths? So how many compressions am I doing to how many breaths am I giving to an adult? Okay, because it's different for children. So am I doing 1 compression and 2 breaths? Am I doing 10 compressions and 2 breaths? Am I doing 15 compressions and 2 breaths? Or am I doing 30 compressions and 2 breaths? Right, another 2 seconds to go. And that's the end of the ball. Right, so 35% of you guys, actually I'll go through all of them. 8% say A, 34% say B, 10 to 2. C is 23%, and the most popular option of 35%, just a little bit more than B, is 30 to 2. So well done for those of you guys who got 30 to 2. That is the correct answer. Okay. So what you do is 30 compressions, you're counting, and then you do 2 breaths. Either, so you can do it with a bag valve mask in a hospital, which is what I'm going to show you in a second, or if you're out in the public. Since COVID, it's actually become optional. So you have the choice to give mouth to mouth to someone. You don't have to, right? Right, so let's go back to our video.
Hi, Emily. Hi, my name's back. Are you able to take over from me? I'll count you in. So 5, 4, 3, 2, 1. Okay. Okay. Can we just get the pads? I'm just going to go ahead and attach the pads around you, Emily. Okay. Sorry, I'm just going to get past you. Thank you. Hi there. Hi, my name's back. I'm one of the medical SHOs.
Hello.
So we've got Sam here. He's a 34-year-old chap who's come in with cellulitis, was given flucloxacillin and allergic to penicillin.
Yeah.
So we've just got compressions going on now.
Fine.
And can I ask you to just get the defib pads and let's get the rhythm check sorted out.
Okay.
Okay, guys, we're going to do a rhythm check shortly. So Emily, can you stop the compressions, please? Let's have a look at the rhythm. That's via back on the chest, please. So we're just going to do.
So what we just did there is we did a quick rhythm check. Now, what that means is when someone goes in cardiac arrest, obviously in the movies, what you see is they bring out these big pads and they shock the patient and everything's happy days, right? That's not quite the case in reality. So there's lots of different things that can be going on, okay? And we connect the patient up to the pads, which is what we've done here. As you can see, the pads are under Emily's hands. Vic is got the bag valve mask, which basically is what's going to give the 2 breaths to the patient when it's time. We've got the rhythm on this green squiggly line, okay? And what that looks like is a fuzzy rhythm, right? Very fuzzy. Very fuzzy is like VF, ventricular fibrillation. What your heart should be doing is your atria contract and your ventricles contract, then your atria contract and your ventricles contract. In VF, what happens is it's just doing that, right? So not enough blood flow is going to the rest of the body, and that is a shockable rhythm. So then we're going to shock the patient. But shocking the patient is a dangerous procedure because everyone could get shocked. So just listen out for the very clear communication. There's already been some good communication examples. The way I handed over to Emily, I was like 5, 4, 3, 2, 1. Emily then swooped in. There was no delay whatsoever. We want to minimize the delay as much as we can.
30 to 2, and can you guys swap so Emily doesn't get tired and whenever you're ready?
Okay.
And I'm going to hand it over to you, Maya, for the defib. It's a shockable rhythm, so we'll go ahead with the first shock, please.
Sure. Okay. I'm gonna charge everybody except compressions away. Charging. Compressions away.
Shock.
Shocking. Everyone back on the chest, please.
Right, so that was such clear communication by Maya, right? She's going to do it one more time, so I want you guys to pay attention the second time she does it. Notice how Vic and Emily have swapped as well, because CPR is exhausting. Studies have shown that people who do CPR for more than 2 minutes in a row, your CPR is no longer effective because you're tired, you're not going to the depth that you need to. So we need to have regular rotations. Like, no matter how fit you are, it is exhausting, okay? So whilst we're doing the CPR, where the whole point of that is to just artificially pump the blood around the body, we're going to be going through different things that can cause cardiac arrest and how we can reverse them. Now, we know with Sam, it's most likely because of the allergy, right? But we're also going to be thinking about the reversible causes. So a little bit of homework for you guys if you want to do it. Think of some of the reversible causes of cardiac arrest, and you can do a bit of a search and learn a little bit about it. But the main purpose of this work experience is understanding how doctors interact with each other, the skills, the communication skills, the leadership, the team working that we use in a high stress situation. And when we listen to Maya again, that is really some really crucial examples of how you can use that in your personal statements, but more importantly in your interviews as well. So what we're going to do over the next 2 or 3 minutes of this, I'm just going to let it play out. You're going to hear a lot of jargon because it's medical terms, but the whole point is we're going through those reversible causes.
Great stuff. So that's the first shock done. So guys, I think he was having anaphylaxis. So what we'll do is we'll modify the algorithm slightly, and let's go ahead and give him IM 1 in 1,000 adrenaline, half a milligram.
Okay.
And so I'm just going to also work through the 4 H's and the 4 T's. Thinking about hypoxia, he felt warm to me when I was assessing him, so I don't think this is hypothermia. I've got the results for the gas on the computer system, and he wasn't having any electrolyte imbalances, so I'm not too worried about any hypo or hyperkalemia.
Okay.
So in terms of, can I ask you, Maya, just to keep an eye on the timer, so when we're 20 seconds away from 2 minutes, just let me know.
Sure.
Also thinking about whether there might be a hypoxia. Again, he was saturating low, but we've got him going on the 15 liters of oxygen. And hypovolemia, his blood pressure was low, but we've given him a stat. Okay, so thinking of the tension pneumothorax. Emily, when you get a second, can we give a listen to the chest, please? I'll give you a stir. And we'll have a listen just to see if there's a tension pneumothorax.
Let me do that whilst you're there.
Yeah.
So we've got about 50 seconds left.
Okie dokie. So if there's no pneumothorax, the trachea central, we're happy that's not a tension pneumothorax. Awesome. And I don't think you could be tampering as a young patient with no previous cardiac history, and unlikely to be thrombus. We will do a proper ECG if we go into ROS. And finally, how are we doing for time?
Yeah, we're almost there. So I'm going to charge again.
Right, guys. So Maya, I'm going to hand over to you.
Okay.
Right, guys. So have a good listen, and maybe we'll make notes on what you're about to hear Maya say, right? Because that is a really good example of how doctors are expected to communicate in a high stress situation and work well as a team, essentially to help bring this patient back.
So everybody but compressions away, charging. Okay, compressions away. Shock. And everyone back on the chest, please.
Right, guys, so we've done 2 shocks now. Let's go ahead and give 1 in 10,000 IV adrenaline for the cardiac arrest dose, please. So, Maya, can you get that? And then once that adrenaline is gone, we'll do another rhythm check shortly. So guys, I think the main cause in this case here is going to be anaphylactic shock. I think that's what's going on. We've given the first dose of adrenaline. We also give the IM adrenaline as well. The patient is on 15 liters, and we're about to do a definitive airway as well shortly. Guys, after this cycle of CPR, we'll do a rhythm check just to see what's going on with the rhythm. Vic, whilst we're doing the rhythm check, please, can you also listen for the pulse?
Yep.
And then Emily, let's try and minimize the delay between the CPR as small as we can.
So just before we go on to the rhythm check, one of the things you may have noticed is every time I speak to someone, so my job here is not to do anything, okay? So every good team has a leader, right? So I'm playing the role of the leader of the cardiac arrest team, and my job is just to stand away, hands off the patient, doing the thinking and doing the delegating of the different tasks. So every time I ask someone to do something, you may have noticed I said, Vic, can you, when we do the next rhythm check, can you feel for the pulse? Emily, let us know when you've come to the end of your compressions, right? So I say the name first because when they are busy counting like 25, 26, 27, 28, they're not going to be listening to anything else. And that is something called bandwidth. And a very good example of that is, let's say you're going out with your friends and one of your friends is on their phone texting and you ask them a question. You may have noticed that they either didn't hear you or they delay their response. They're not as on it, right? And that is because they are so focused on texting or whatever they're doing that they have not, it's taken their brain less time more time to process what you asked. And that's exactly what we have identified here. And that's why saying someone's name, like Vic, it gets them to be like, what? And then you ask the question. So you prevent that bandwidth being saturated. Right. Cool thing here is keep looking at this really squiggly, very fuzzy line. As we do the rhythm check, right, we've given the treatment, which is for anaphylaxis, it's adrenaline. Let's see if it fixes that.
Okay, so let's do a rhythm check.
Guys, we have a rhythm compatible with life. Have we got a pulse?
We have a pulse.
So this actually never happens in simulation. The fact that it worked perfectly was amazing. But yeah, so we got a good rhythm, and let's see if we got a pulse as well.
Yeah, I can feel.
We have a pulse. Okay, that's fine. So let's keep.
Right, so we've got a pulse, okay, and we've done our compressions. So final question for you guys on that point is, let me relaunch the poll. What would you do next? Would you continue the CPR? Would you leave the patient there? Would you contact ICU for post-resuscitation care? Or would you restart the antibiotics that started this mess in the first place, right? Give you guys 5 more seconds to answer, and then we will call it a day with our work experience for now. Right, I'm going to end the poll. So almost 90% of you guys are going with contact ICU for post-resuscitation care, and you are right. So well done. Yeah, so as a team, we saved that patient. So that was about a half an hour session on work experience, taking you through what we do as doctors when a patient becomes unwell, when they deteriorate, go into cardiac arrest. Now, in reality, cardiac arrest situations take a lot longer. You know, we were doing like more cycles than the number of cycles we did. We only did 2 cycles, and you just keep repeating whilst you're trying to fix things, right? And the in-hospital cardiac arrest rate, because you've started CPR correctly, you've got the equipment, is a lot higher than if someone is to have a cardiac arrest outside the hospital. But anyway, a little bit of experience for you guys there to kind of think about what kind of questions you could get asked, but also to reflect on, would you like to be in a position that does that? Someone who does that, which is basically my job now as an emergency medicine doctor, to be in these kind of teams, to work under stress, to work with a team of your friends that you're really good friends with, to basically, you know, get serious with someone and potentially in this case, save someone's life, right? So that's a bit of motivation, thinking about the skills that are required and so on. Right, so going back to our presentation now. So this is a work experience workshop. A lot of you guys, I'm sure, have signed up for it already, but if you haven't signed up for it, I would highly recommend that you guys do so. It's happening next Sunday on the 22nd of Feb at King's College London. It's pretty much most of the Sunday, right? Like I said, we've got over 3,300 people signed up for it. We've only got about 300 spaces. I'm going to talk to you guys about a little bit in terms of how you can guarantee a spot or how to get an in-person ticket so you can attend. More about that later. So what we're going to do is more of what you've just seen, but we're also going to have other specialties. So giving you a taste of emergency medicine, got surgeons coming, right, to give you a taste of what their job is like, pediatricians, right, medical doctors and other specialties who are all going to tell you what their specialties like, what are some of the pros and cons of their specialties, so kind of appeal to lots of different people. Now, this workshop on next Sunday is mainly targeted towards medics, and I know I've got a lot of dental applicants here. We are currently planning an amazing dental work experience workshop as well, either in March or April. More on that later, but yeah, we're in the stage of just finalizing a few more things, but as soon as that is confirmed, I'll let you guys know. But the workshop next Sunday is targeted towards medics. Dentists, don't feel left out. Okay, guys, don't worry about hands up. I'm not going to be able to answer or see your questions, so we're going to answer those questions later in the Q&A. But if you haven't signed up, this is the QR code to scan, so you can go ahead and sign up for that workshop. All right, I'll leave that for another 5 seconds before we start going into the next bit of your timeline. So that was just the first bit, work experience, right? The rest of the sessions are going to be quite quick anyways. So after your work experience, which is over the next few months, that's what you should be thinking about. We're going to do a work experience workshop next Sunday. We're going to do another one for dentists around March, April time. And you guys should also be trying to get more work experience if you can. However, if the work experience you've just seen, the cardiac arrest simulation, and if you get a chance to come to this work experience workshop on next Sunday, that's enough. Honestly, don't stress over it too much. If those are the only 2 bits of work experience you've got enough for your personal statements, you've got enough for interviews, and you've got enough for most of the universities that you'll be applying to. So that's it, right? Anything on top of that is just bonus. So don't stress about work experience too much. And that's why I run these sessions, and that's why these sessions are so important. Next up, next challenge. So work experience is probably going to be from now till like April, May time. Okay. And then June to like August is the things that we're going to talk about here. Okay, so personal statement is going to be the next challenge. Now, personal statement, think of it as like a CV that you have to write. Everyone has to write one when they're applying to university. And the personal statement criteria has changed slightly over the last few years. It used to be just one long personal statement that people wrote. What they've done now is they've separated it into 3 segments. And the new personal statement, it still has the limits of 4,000 characters. Okay, right? And minimum 500 words per each section. I believe that's the last time I checked it. So these are the 3 sections. So the section 1 is, why do you want to study medicine or dentistry? That's section 1. Okay. Section 2 is, how have your qualifications and studies helped you prepare for this course or subject? So like, what have you done in school, basically, that's helped you prepare for medicine or dentistry? And then finally, what else have you done outside of education? So this is your extracurricular stuff. And why are these experiences useful? So this is, think of it as like school and maybe a bit of work experience. And this is your extracurricular stuff, like your hobbies, and also a little bit of work experience if we want to talk about it here too, or any EPQs that you may have done. So those kind of things. And this is like your intro. Okay. Now, this is just a bit of an overview. You guys don't need to be stressing about personal statements for now. Leave that in the back of your head until we get to summer. And the Medic Life, we're going to run some free personal statement workshops to help you support writing a personal statement, writing a good personal statement, and we're going to have actual proper work personal statement sessions for you guys. But for now, I just want you to be aware of it. Don't worry about it for now. Okay. UCAT. Right. Can I get thumbs up or thumbs down? Who's heard good or bad things about the UCAT? So if you've heard like bad, scary things about the UCAT, maybe a thumbs down. If you've got, or like a scary face, I don't think there's a thumbs down option. Maybe just thumbs up or like a scary face or whatever, right? But yeah, UCAT, honestly, it's one of those things. When I was in your position, I did the UCAT, right? I was like, I'm never doing this exam again. I hate it. Then I had to take a gap year and I had to do it again. So I had to do it again. Then I did it like twice, right? The second time I did it, the first time I did it, I was in the top decile. Second time I did even better. I was even further up the top decile, which is great, right? I was like, oh my God, I can't believe I've done it twice. And little did I know that I would then go ahead and teach it for like 10 years. And actually, I absolutely love the UCAT now. I think it's such a fantastic exam because it's an exam that doesn't test like your knowledge, it tests what kind of a person you are. And people who get that, if they understand that well, they end up doing really well on the UCAT. People who don't get that bit right don't do so well on the UCAT. So that's what the Medic Life is all about, and that's how we support you. So some important dates, guys, get ready to submit, make some notes, okay, if you haven't been already. 12th of May is when the official UCAT registration opens. So this is when you need to register an account. You need to basically tell the organization that you're someone who's thinking about sitting the UCAT in the summer, right? So that is when registration opens. So from the 12th of May onwards, you need to start making an account. 23rd of June, super, super important. Now, every year I say this to my students, right? Every single year. And every year I still get some people who didn't listen to me and then they regret it afterwards. 23rd of June, this needs to go in your calendar today. Right? So either put it into your calendar right now or make a note that you're going to put it into your calendar. 23rd of June, usually in the mornings. This is when test bookings open. So you need to, on that day, on the morning, apply for a slot. There's lots of different test centers. There's so Pearson VUE centers are across the whole of the UK and in other countries as well if you're watching from abroad. Now, you need to pick a time, date, location of when you want to do the exam, because you can do the exam from any time from the 13th of July until the 24th of September. So you need to decide where you're going to sit it, so you don't have to go too far away. There's different test centers. Bigger cities have more. Smaller cities only have one. Some cities don't even have one, and you have to go to the next city, for example. And you need to decide the date and so on. If you don't do that, right, even after just like the first 20 minutes even, the slots get taken up. So what then happens is you will no longer get your date there, and you will definitely not get the location you want. Every year I have students telling me like, oh my God, I'm so like, I didn't do it on the day. Now I have to go to a city, like I have to take a train 2 hours away. It happens. So yeah, 23rd of June needs to go into your calendar. 13th of July is the first testing date, and then 24th of September is the last one. So you get a big window. You get to choose whether you want to do your exam in July, August, or September. And we're going to talk about in a moment when the best time to sit your exam is as well. Because statistics show people who sit their exam earlier do better than the ones who do it later. And there's a reason for that. We'll talk about it later. Then there's things like access arrangements. So if you're someone who gets extra time, or you've got extenuating circumstances or anything like that, you will get extra time. You have to apply for that. There's an application deadline for that as well, so don't miss it. So registration closes, and online booking closes 16th of September. None of you should be leaving it this late, okay? So 16th of December, you can't book any more test slots. There's a bursary scheme as well. So if someone, if any of you guys are eligible for this bursary scheme for the UCAT, have a look at that. You have to apply for that as well. They haven't released the actual deadline for that, but it's going to be sometime in September, but make sure you apply for it. And the UCAS application deadline, so UCAS, one with an S at the end, is the portal through which you apply for medical or dental school. That is 15th of October. That is the deadline. I'm setting all of you an internal deadline of the first day of year 13. First day of year 13, I want you guys to have done your UCAT. I want you guys to have pretty much finished your personal statement. And I want you guys to have pretty much finalized which universities you're going to apply for. That's going to be in September, early September, which means it then gives you another month to tweak those things a little bit with the help of your teachers if you need to. If you do it this way, your life's going to be so much easier. All right. So that's the whole point. So you stick with the Medic Life. We're going to do loads of different events throughout the year. The whole point is that I'm going to support you through it all. Right. Yes, your school is going to help you as well, but we have far more experience than your schools do. Okay. Right. So that's your UCAT dates, and then UCAS. Like I said, this is the portal. Now, some of you guys, some of your friends will have a different deadline. Some of your friends will be like, my deadline's in January. What are you doing? Why are you doing it so early? That's because they're not applying for medicine or dentistry. Medicine or dentistry has a deadline in October. Everyone else has a deadline in January. So don't listen to them. Your deadline is October. Right, so UCAS, this is when you get to apply to 4 medical or dental schools, okay? And then you have one final option as a backup, right? But our main goal is to pick the right 4 unis. There's close to 50 medical schools in the UK, just over 40 actually, and there's around just under 20 dental schools in the UK. You only get to pick 4, and you have to pick those right because all of them have different criteria. And guess what? We help you with that too. All right. So there's videos like this. Okay, I'm going to play that for you.
If you scored between 1900 and 2100 in your UCAT, then this one is for you. Welcome to part 2 of applying strategically to medical or dental school based on your UCAT score. If your GCSEs are okay and you scored between 1900 and 2100, then I want you to check out Queen Mary, Leeds, and Lancaster. However, if you smashed your GCSEs, you've got loads of 9s, a couple of 8s, and then you scored in that same range as well, I want you to go and check out Nottingham and Cardiff because these guys give massive points for GCSEs. Good luck with your application.
Right. So one of the things we do at the Medic Life is every year we look at all the universities, and there's so much data. So we basically do all the hard work for you guys, right? And yeah, so we basically do all the hard work for you, and all of you guys have slightly different criteria. Some of you guys have done really well in your GCSEs. Some of you guys have done okay. Some of you guys are in the middle. Some of you guys are like the top 2 deciles of UCAT. Some of you guys are a little bit lower down. So there's lots of different variables, right? So what we do is we are going to run workshops this summer where you can come onto our workshop. Again, it's going to be free, but it's going to be added additionally, especially for those who are on our UCAT courses. So we're going to focus on those guys more, where you come to these workshops and we basically just go through different groups of people, split them up into different things, and suggest universities where if you apply strategically, even though you may not have the best UCAT score or the best GCSEs, you'll still get all your interviews. That's the whole point. Now, this QR code on the side is our broadcast channel on Instagram. So if you want somewhere where we just get regular updates through social media, join our broadcast channel. I'm the only one who ever messages on there, and we keep it pretty chill, right? We only put in things that are useful. So if I see an article that I'm like, whoa, this is useful for you guys to read, I'll put it in there. Or videos like this, so you don't miss them, I'll put them in there as well. So go ahead and join this broadcast channel if you want to. This is for the application cycle for this year, all right? Now, going back to applying strategically, every year I get candidates who did amazingly, and they're like, yeah, I'm gonna smash my medical dental school application. They're like, I've got all the 8s and 9s in GCSEs, I've got such a good UCAT score, and they don't get any interviews at all, right? Because they didn't apply strategically. This is a message I had a few months ago, right? Someone who got amazing GCSEs, right? 3 A-star predictions at A-level, top 2 deciles of the UCAT. However, they would have got rejected by King's, they would have got rejected by UCL, and they would have got rejected by Bristol based on those stats. They didn't know that, right? So applying strategically, even though with good scores, you still need to be thinking, okay, what these universities want, where do they give the points? And that's the homework that we do for you guys, right? So we're actually developing a tool where you just put in your details, like your GCSEs, your predictions, your UCAT score and stuff, and it just chucks out some universities for you guys to do some deeper reading into and then apply strategically. That's the whole point. Right, so if you get a good score in your UCAT and you've done well in your UCAT and you applied strategically, you'll then ideally get 4 out of 4 interviews, right? So 4 out of 4 interviews, and that is then the final big hurdle between you and getting into medical or dental school. And that's where our interview courses come in. Now, over the last few years, the Medic Life MMI courses have been some of the most successful interview courses. Like I said, we've got a 98.6 It's actually higher than 98% success rate with our interview courses. We run a 1-day interview course. It's delivered by doctors, dentists, and med students. We tailor it towards whether you're applying for medicine or dentistry. We have 2 mock circuits where you go through mock interviews, essentially, and we give you over 2 hours of personalized feedback. Now, this is the thing which sells out months in advance. Even our UCAT courses do sell out, but our interview courses, they usually get sold out for months in advance. We release them in October, and immediately on the day, or usually within 24 hours, November and December sell out, right? So what we do is we release them a day early. So we give early bird access, 24 hours early access to any of our UCAT students as well. Something to think about. And then these are just some of the students. These are not even all of them. These are just some of the ones over the last few months that we've been helping with our interview courses. And yeah, getting messages from these guys about getting into medical dental school, which is fantastic. So I'd love for you guys to join that community as I keep talking about. So going back to the one that we never like, right? So if everything goes well and you get your offers, summer 2027 is when we start medical dental school. That's the plan. However, the big hurdle that sits between us and our offers is the UCAT. So what we're going to do is, if you guys need to quickly grab a quick drink or whatever, go and do that, because now we're going to go into the UCAT. So we're going to spend the next about 40 minutes or so going through some actual UCAT questions, giving you techniques and giving you a taster of what our UCAT course is all about. Not even 40 minutes, about half an hour or so, right? So what is the UCAT? It stands for University Clinical Aptitude Test. It used to be called UKCAT, but Australia and New Zealand have started doing it as well, and they've got rid of the K. They just call it the UCAT now. It's the entry requirement for medicine or dentistry. If you're applying for medicine or dentistry in the UK, you have to do this exam. There's no way around it, right? Graduates, you may have heard of GAMSAT, which is another exam, but UCAT is the most popular one. It's roughly 2 hours. It's just a little bit under 2 hours for the standard time. If you get extra time, that's a bit more. And it's taken at Pearson VUE centers, as I mentioned before, right? Remember that booking test deadline, right? Booking opening day. Make sure you find your closest one, and that's where you want to go and sit it. Last year, just over 41,000 people sat this exam. So huge competition. 41,000 people sitting this exam for about 7,000 spaces, right? Just over seven and a bit thousand spaces. So that kind of helps you understand the competition ratio of about 1 in 7, 1 in 8 for medical dental school. Important dates, we've already been through that, right? Put that 23rd of June in your calendar. If you haven't already, make sure you have registered for your UCAT account by after the 12th of May. And 15th of October is the official deadline, but I'm setting you guys, all you year 12s, my deadline, which is a month before that, first day of year 13, okay? That's when you should have done your UCAT, you should have done your personal statement, you should have thought about this, like universities you want to apply to and so on. Right, so this is the format of the UCAT. Think of it as 4 mini exams squished into one, right? So there's 4 sections: verbal reasoning, decision-making, quantitative reasoning, and situational judgment. This is the number of questions that they all have. You can take a picture of the screen. You don't really need to worry about that for now. And the only time you get in between the 4 mini sections is the minute and a half, 2 minutes, and a minute and a half. That's it. The timings for those sections and the scoring. We're going to talk about those bits in just a moment. Now, I kid you not, I'm a qualified doctor, right? I have been so for a while. I've done hundreds of exams in my life. I have never done an exam that requires so much focus and is so time pressured as the UCAT, because guess what? That's how it's designed. It's designed to be that. What you just saw us doing, right? Cardiac arrest situation, high stress environment, time is important. We have to make the right decisions. We have to prioritize the right things in the right order. That's exactly what the UCAT tests. All of you have, give me a thumbs up, right? Interact with a thumbs up if you've done GCSE maths. And just look at it, all right? GCSE maths is compulsory in the UK, so all of you should have done it, right? So why do they need another 26 minutes of maths? We already know your GCSE maths. A lot of you guys may even be doing A-level maths, right? So why do we need to test it for another 26 minutes? That is just a distraction. The maths is a distraction to see how many of you can stay calm under pressure, how many of you are actually dedicated enough to spend weeks on this nasty exam and prepping for it? Because guess what? Being a doctor or a dentist is a lifelong career of learning, right? Can you prioritize the right things? They make every single question the same mark, okay? Every single question is worth 1 mark. Yes, there's an exception. Don't worry about that for now. Every single question is worth 1 mark, but some of them are super easy and some of them are super hard. So the whole point is prioritizing accordingly, and that's how they test it. So I think the UCAT is a very clever exam. Right, so scoring. The first 3 sections are scored between 300 and 900, giving you a total of 2,700, okay? And the final section is banded from 1 to 4, situational judgment. So what you want is you want a really high score and you want a really low band, That's what you want. Okay. Let's have a look at some averages from last year. So averages, bear in mind, each one of these is out of 900 each, right? Now, give me some thumbs up if you predicted A's or A stars, or if you want to get A's or A stars in your A levels, right? And most of you guys, yes, that's what you want, because that's what's required for medical or dental school, isn't it? And if you don't get that, well, what's the point of applying to medical or dental school? And A is 80%, A star is 90% usually. So a lot of you guys have come from this cohort of these really intelligent students from all the different wonderful schools across the UK and other countries even, where you're used to getting 80, 90, 100%. But we get all of you guys, we put you at these Pearson VUE centers. 41,000 people sat this exam last year, and the national average was about 50%. The exam is actually standardized. So the national average for verbal reasoning, 600 out of 900, because it's standardized, is actually below 50%. Why is that? It's because people don't approach this exam in the way that they need to. A lot of people don't actually finish it. Well, no one finishes actually. Let me correct that. No one finishes the exam. It's designed to never finish. You can't finish it. It's like being a doctor in emergency medicine. The patients never end, right? However, picking and choosing the right ones is important, because if someone comes in with a heart attack, right, but someone's been waiting for like 3 hours with a twisted ankle, who am I going to focus on first? The guy who literally just came in with a heart attack, aren't I? Right? Because that's more urgent. Apply the same principle with the UCAT. Some questions are more urgent because they are easier to do. You can do them in less time, which means you can do more questions. So let's have a look at what that looks like. So we're going to do some sample questions now. I'm going to time you guys. I'm going to give you a little bit of a taste of what UCAT's all like, and you're going to get a little bit of taste of how our courses run. These are snippets from our UCAT courses, which I teach. So verbal reasoning, you get 11 passages. A passage is like a body of text and 4 questions per passage. You get 22 minutes for the whole sections, which means exactly 30 seconds per question. All right, you guys ready? I'm going to time you. I've got my stopwatch ready. We're going to time you, and then we're going to do a little quiz and a poll to see how you guys are doing in terms of your questions. Your time starts now. Right, 3 seconds to go, and here is your poll. So A, B, C, or D, you have no more time to think. Okay, just answer A, B, C, or D. That's all you got to do, right? And I'm going to give you guys, and even the fact that you guys are taking so much time picking an option, you're wasting time, right? You should have picked an option straight away and you're ready to move on. So every second you don't pick an option or you dilly-dally, you're wasting time, right? So it's one of those exams you have to be super quick with. Right, so we've got 12% for A. I'm going to end the poll actually. So 12% for A, 33% for B, 42% for C, and then 13% for D. So a bit of a mix all around. Now, I can tell if a question is easy or hard based on how all over the place the answers are. And clearly this one was a hard question because no options got even more than 50% answered, right? So going back to this question. So first thing you want to do with verbal reasoning is ignore the passage. Okay, ignore it, go straight to the question. Which of the following conclusion is most likely to be true? Now, straight away, I know there's no keywords. This is an open question. It's basically a generic statement. Which of the following is most likely to be true? It's a relatively long passage. That's 2 big problems. Open question is a problem, and it's a longish passage. That's another problem. I would guess B, because B is my favorite option. My name starts with B, and I'll just move on. That's what I would do. I wouldn't even do this question. And the reason for that is 60% of you guys didn't get this right anyway, and you wasted 30 seconds, and that's because I stopped you. Had I not stopped you, you guys probably would have kept going and you would have wasted a minute, maybe a minute and a half. So this is what happens with most people. So let's say with these kind of questions, because there's no keywords, you have to start with each option one at a time. And maybe some of you guys did that. So we'll start with A. A British driver is the favorite for this year's Formula One season. The keyword is British. I'm going to give you all 10 seconds to try and find British. Give me a thumbs up once you've found it. 10 seconds start now. Right, so that's how we waste 10 seconds. And 16 of you guys who've put your thumbs up, where do you find British? It doesn't exist. I wrote this passage. It's not in there. So you guys are just chatting, right? So yeah, British is not there, which means that this can't be the right answer anyway. But we've wasted 10 seconds. We've already wasted 15 seconds or whatever, right? The time is clicking, right? That's one of the things. B, your keyword in B, majority of the races in 2018 season took place in Europe. 2018 and Europe are good keywords. And when you find your keyword, what you want to do is you don't want to read the passage. You're basically scanning. It's like Find Wally, right? And you're finding like 2018, boom, there, and Europe, boom. And that's when you stop scanning and then you just read those few words. 11 of 21 races in 2018 season taking place outside of Europe, right? So 11 of 21, majority. What does that mean? So in the UCAT, there's some words. Majority means over 50%. Most means close to 100%. All obviously means 100%. And a few can be any small number. Okay, so majority is over 50%. So 11 of 21, is that 50% or not? We don't know, right? A quick way you can do, yes, you have access to a calculator, don't use it, nightmare. Double 11, and it should be, so 11 over 22, because that's double, would be exactly 50%, right? So therefore 11 over 21 would be more than 50%, and therefore this is majority, and they took place outside Europe. This says in Europe. Incorrect. Therefore, we move on to the next one. Okay. C. Now, majority of you guys by this point would have gone well over the minute mark, right? We get to C, and it says running a Formula team is an expensive ordeal. Expensive is a good keyword. We look for something to do with expensive, something to do with money. $120 million. It says annual cost of running a mid-tier team, designing, building, and maintaining cars, paid, transport being $120 million. Acquisitions of $8 billion, partners $4.4 billion in cash. Big numbers. No matter how rich you are, this is big numbers. So we can infer, and this is an inference, that yes, probably is an expensive ordeal. And therefore, well done to those of you guys who picked C. But remember, professional, an expert, thing I would teach you is you would have never done this question in the first place. Because some questions are designed to make you waste a lot more time to get to the answer than the ones that you should just go and do instead and get more marks, right? So this is a question. I'm not saying don't ever do it. I'm saying just come back to it. The whole point is triaging. Triage is a technique that we use in the emergency department at multiple moments, like the example I gave you, heart attack versus twisted ankle. I don't care how long the twisted ankle has waited. If a heart attack comes in, I'm going to go see them first, right? That's called triage. I'm not discriminating. The heart attack just needs me more. That's why. Same with these questions. This is a twisted ankle. Keep it waiting. Go and get an easy question first. All right, let's look at some more question types. Okay, well done for getting that one, guys. Let me give you another 30 seconds for this one. Five seconds to go. And here is your poll. Go ahead and answer for me, please. I'm only going to give you 3 seconds to answer. 1, 2, 3. Those are some long 3 seconds. Okay. Anyways, right. So we've ended the poll here, right? And usually I can tell, again, like I said before, is whether you guys, this question was easy or difficult based on how unanimous you are. 71% of you guys picked B. Okay. 71%. B's wrong. I'm sorry to say that, but B's wrong. Okay. I'll tell you why in a second. So all of you guys wasted a lot of time and you got the wrong answer. Let's use the method I taught you before. There's no keyword here in the question. So it's an open question. The passage is long again, right? Another question, I would just guess B, and I would have just guessed B because 71% of you, because my name is Bakhtar, right? I just picked B every single time. I'll tell you more about that why at the course. So, and I would have just moved on. I wouldn't have done this either. Twisted ankle, right? Because I know it's an open question. It's going to take me long, and it's a long passage. It's going to take me ages. Probably going to get it wrong anyways, like 71% of you did. That's why the national average for verbal reasoning is less than 50%. Anyways, let's say I go and get all the easy marks. Then I've got time. I come back to it. This is how you want to do it when you come back. You don't do it the first time around. You come back, then you do it. So A, the knowledge has changed twice since it was initiated. By the way, because there's over 600 of you guys, this is not interactive. At the course, it is totally interactive. Like you guys will be doing most of this and like we'll be talking about it together. Right, so one of the first thing is true, right? So this is what true, false, and can't tell really means. A true means it's a match. Now, it doesn't have to be a direct match. It's something that's similar in the text. False means it's mentioned, but it's totally incorrect. So it's the opposite, right? Kind of like the question before where it said outside Europe versus in Europe. That's a contradiction. Can't tell is a confusing one, right? This is when you basically, it's either not mentioned or you're just not sure, right? So we're looking for something that's a match. Initiated would be a good keyword. I scan for it and I find it here. It says it was initiated in 1865 and has changed little since. This is saying it's changed twice. That's not true. That's not a match. It's a contradiction. Now, majority of you guys picked B because you saw 25,000 as a keyword, right? 25,000 streets within the 6-mile radius of Charing Cross. You saw 25,000 streets, Charing Cross, you got excited. However, you missed the word some, which basically means approximately. That's not a match. That's a can't tell answer, okay? Because you're not sure exactly if it's 25,000 or not. This is exactly 25,000. This is around 25,000. You're unsure. So you can't be unsure. A match needs to be pretty positive. So B is also incorrect. C, shorter courses for suburban London consist of less than 320 runs. Suburban London, 320, these are good numbers to go for, right? So shorter courses for suburban London with 30 to 50 runs, less than 320. 30 to 50 is less than 320. That's why that's the correct answer. So well done to 50-something number out of 600. Only 50 out of 600 got this right. Well done. Okay, right, another 30 seconds, go for it. Five seconds to go. And here is your poll. All right, only got 3 seconds to quickly answer. Put something down. You're going to be speedy with this stuff, all right? So we put an answer down, we move on. There's literally no time to dilly-dally, right? Okay, another question where we've got 38%, 12%, 25%, 25%. So big variations. A little bit better, this question, right? So this question is a little bit better, is because it does have a keyword. The knowledge is demanding. Demanding comes up in the second paragraph. So most of my information is likely to be there. However, there's a challenging aspect that there's the word not, which turns this question on its head, right? So the way you approach these negative questions is you focus on this bit of the text and you then look for these keywords. Takes 34 months to pass on average. It says 34 months to pass. But because it's a negative question, you're not looking for matches anymore. If it's a match, you eliminate it. So you eliminate A because it's a negative question. We'll go through more of these at the course, obviously, but this is just something to get you started with. Then you move on to the next one. Consists of 10 appearances, 10 numbers, names, keywords. These are good keywords like numbers, names, locations. That's good stuff. However, notice how 10 is here. It says 12, but it's not written as 12. It's written as 12 as in TWELVE, right? So 12 is not 10. And therefore, because it's not 10, that's the correct answer. And interestingly, B was only 12%. It was the least favorable choice because you guys probably failed to acknowledge the not. And that's why the most popular option was A, which unfortunately was incorrect, right? This doesn't happen on your test day and in the real mocks, but just for the purpose of today, I want to show you other types of questions. There's different types of questions, right? So these are comprehension questions. You also get the easier, slightly easier questions that are true, false, can't tells. Give this one a go, guys. 30 seconds. Five seconds to go. Right, 30 seconds aren't fun, are they? Right, 30 seconds is quick, but hopefully you guys noticed that this question was a little bit nicer, wasn't it? So go ahead and answer. And I feel mean because I've purposefully picked some cheeky questions for you guys just to give you a taster of what it's like, right? Verbal reasoning is nasty. You know that because obviously less than 50% is the national average. So I'm going to stop the poll here and we can see that 77% of you guys said A. Apologies for the D option, don't worry about that, right? So that's what majority of you guys said. However, with these true false can't tell questions, there's less to do, and therefore I would always recommend doing these questions. A taxi driver must know the points of interest, including streets, squares, clubs, hospitals, hostels, and theaters. Those are my keywords. I'm going to scan, 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 but I'm scanning until I find my keywords, which are right there. Okay, so streets, squares, clubs, hospitals, hotels, theaters. Only 10% of you, only 50% of you guys noticed this, right? Hotels, hostels, and that's not a match, right? So well done to only 50% of you eagle-eyed students here who picked that. So because it's not a match, it's therefore can't tell, right? So hotels or hostels, for example, hostels is not mentioned in the passage. And that was cheeky off the UCAT, but this gives you an indication as if something from the question is not in the passage, it's can't tell. And this is a really good takeaway for you guys, right? My default option with true, false, can't tell questions is always can't tell. If I'm going to guess, I always guess C, okay? Unless I can prove that it's in the passage and it's a match, therefore it's true, or it's in the passage and it's contradiction, in which case it's false. Otherwise, I just always go with C, right? So if you're ever going to guess, just guess C. Right, team, final question, 30 seconds. Five seconds to go. And there's your poll. Go ahead and answer for me, please. And the notorious 25,000 numbers there again, probably stressing you guys out. Okay, so we're going to give you 2 more seconds and we're going to stop it there. Okay, so 13% for A, 59% for B, and 27% for C. So B seems to be your favorite option so far. The guide to learning the knowledge includes 25,000 standard roots. Now, as you get, so each passage has 4 questions, right? So we've got to the 4th question of this passage. We know a few bits here and there. We already know that 25,000 is there, so we can maybe even start there. That's one keyword. The other keyword would be standard roots. Just 2 lines above, it says standard roots. So it's not 25,000 standard roots, it's actually 320. So therefore, that is not a match, it's a contradiction. And well done to 59% of you guys who picked B. That is the correct answer. So you're starting to get the hang of it, aren't you? So verbal reasoning is all about picking and choosing the right questions, which ones to do first, which order to do them, how to use keywords, how to go through it. You don't have a lot of time. Time is an issue. So the whole point is go and pick the best questions first, come back to the harder ones. So we just did verbal reasoning for what, like 10, 15 minutes? We're going to do 2.5 hours of verbal reasoning on our course. Something for you guys to think about. Let's move on to decision making. That's the second section. You get 35 questions and you get 6 different types of questions. So in verbal reasoning, you got comprehension questions or true, false, can't tell. That's it. In decision making, you have 6 different types of questions. You get a little bit more time, 37 minutes, and you get 1 minute per question roughly, right? That's just a generic kind of division. You get a few minutes left over, but each one of those 6 questions, I'm going to tell you the specific timings that you should be thinking about for those at a later date. For now, we're just going to look at 2 question types. So for the first one, I would love to give you guys a minute. Give this a go. You can make some notes on a piece of paper if you want. Actually, before we do that, let me stop that for a second. So on decision making and quantitative reasoning, you also get, you get for the whole exam a note board, which is like a flip chart with a marker, so you can make notes. So if you haven't got something to make notes from already, grab something quickly. The other thing you get an on-screen calculator, which is a nightmare to use. So the more you can avoid it, the better it is for you. But sometimes you need to use it. But to mimic that for today, just use your phone calculator. Do not use a scientific calculator. Use your phone calculator, because the on-screen calculator is a very basic calculator. Right, we're going to give you a minute. All right, guys, 5 seconds to go. And here is your poll to answer your questions A, B, C, or D. How many students sat both music and biology? You only got another 3 seconds before I take this away. 1, 2, 3. Okay, there we go. So 10% for A, 33% for B, 39% for C, and 19% for D. So again, quite a mix, right? This is a pretty straightforward, easy question. So in decision making, you've got 6 different types of questions, and you read the question, how many students sat both music and biology, and then you read the STEM. The SEM says, during the recent GCSE exam, some of the students sat music exam, 190 sat biology exam, 40 sat the French exam. Some students sat multiple exams, including 2 or all 3 of the above subjects. That's my clue right there, 2 or all 3 of the above subjects. Immediately I'm like, aha, Venn diagrams, right? Because that's a question type, Venn diagrams. I need to represent the 3 subjects as 3 different circles, and I'm going to start filling them in. So I already know 190 sat music, 40 sat French, okay, and some students sat multiple exams, and that's how they're overlapped. 15 of the students sat only the music. So only music means it goes in here. So that's 15, right? 142 sat only biology. That goes in there. There we are. 9 of the students sat both music and French. So music and French is 9 in there. And 6 of the students sat French and biology. French and biology means 6 goes in there. 8 students sat all 3, right? So the question says, what's this one over here? So all you got to do is 190 minus 142 minus 6 minus 8. And you do that. You can do it in your head or you can do it in a calculator. You get the answer as 34. So well done to the least popular option of D. Well done to those of you guys who got that correct. So not a difficult question. Once you know how to do it, once you know that you need to utilize your noteboard. And again, these are the kind of tips that you'll be learning at the course. Let's do one more example. This is an example of a logic puzzle. These are nasty. All right, 60 seconds, guys. And you definitely need to make some notes for this one. You can't do it in your head. Five seconds to go. And here is your poll for just another few seconds. Go ahead and answer. If you haven't done it, just guess something anyways. I'm going to give you a few more seconds to answer it. And the fact that only a third of you have answered so far tells me that quite a few of you didn't finish. So let's go through it. So we've got 17% for A, 17% for B, 38% for C, and 28% for D. Again, quite a bit of a mix. Difficult question, wasn't it? Right? So with these kind of questions, these are logic puzzles. Logic puzzles are basically spatially orientation kind of puzzles that you have to go through. And you always start at the top. So Peter, Claire, Henry, Michael, Emma, and Dan are the only people in a queue. Claire and Emma are the only girls. So we've got 4 boys, 2 girls, 6 people. They're standing in a queue. So what I want to do is I want to orientate my queue. And I want to be like, okay, they're all queuing this way. This is the last person. This is the first person. That's one of the first things you need to do. Okay, orientate on your noteboard what you're doing. So there we go. We got 6 dashes. Then you got 3 rules. Okay, usually you'll have 3 rules, and you need to find the one you have to start with because they're jumbled up. So there are 3 boys between the girls. Peter is between 2 boys. I don't know where anyone is right now, so this is a bit difficult to start with. Claire is ahead of Emma in the queue. So the 2 girls, Claire's ahead of Emma. Emma is just behind Dan. This is interesting because I know that Claire's ahead of Emma. There's also 3 boys between the girls. So there's Claire and 3 boys. So 4 people ahead of Emma, and she's behind Dan as well. So I'm going to guess that maybe Emma could be at the back and she's just behind Dan, and 1, 2, 3 boys between Emma and Claire. So let's put it this way. Let's trial it. And then the next rule says there are 3 people between Michael and Dan. Okay, so Dan, I know where he is. 1, 2, 3. I'm going to put Michael. The final 2 people left are Henry and Peter. It says Peter is between 2 boys. So Peter cannot be next to Claire. He must be next to Dan and Henry. So that's my rule. Okay, so well done to any of you guys who got that rule, right? You got that correctly. And if you do that, you go through the options. It says there are 3 people between Claire and Peter. Nope, there's only 1 person. Emma's at the front. Nope, she's at the back. Dan is in front of Michael. No, he's not. And therefore D is the correct answer. So well done to you guys who picked D. However, what if I tell you we all just wasted our time, right? So yes, you can do that, and you can probably get an average score in decision making, but this is how you get into the top decile. Let's restart. Okay, we restart. You're now using the tips and techniques that I'm giving you. So we're at that stage where we've read the information. We've realized that the first one is not a good start. The second one is a good start. So we put Emma at the back, Dan, 1, 2, 3 spaces, Claire. These are kind of tips and techniques I'm telling you about, okay? Most logic puzzles, you don't need to finish. So we're not going to do any more. Let's see how many we can eliminate based on just this information. There are 3 people between Claire and Peter. No, there's 3 people between Claire and Emma. Emma is at the front. No, she's not. She's behind Dan, so she can't be at the front. Dan is in front of Michael. No, he's not. He's in front of Emma. So I've already eliminated 3. I'm going to pick D anyways. So your most logic puzzles, you don't need to finish, right? And the way you go about them, you can just do them there and then. And there's other rules as well for you guys to think about. That's how you can get yourself in the top deciles. Right, that's decision making done. We are running a little bit behind time, so I'm going to speed up a little bit. Quantitative reasoning is the next section. You get 9 data sets. Okay, so these could be tables, pie charts, graphs, whatever. And you get 4 questions each, giving you a total of 36 questions. You've got 26 minutes to do them in. And yes, timing's a little bit better than 30 seconds, but I set 30 seconds as my base time because that's the amount of time it should take you to get most of the easy and medium questions, the medium difficulty questions. And one of the things I want to do is I'm going to show you my example of twisted ankle versus cardiac arrest. Okay, so I'm going to give you a poll. I'm going to show you 2 questions in just a moment. I'm only going to give you 4 seconds per slide. So you get to see question number 1 for 4 seconds, make your observations. Question number 2 for 4 seconds, make your observations. And then I'm going to ask you a question. Okay, so this is question 1. Same pie chart, different question. Question number 2. Right, so are you going to do 1 or 2 first? What do you guys think? Which one do you think is easier? 1 or 2? Just based on the fact that you didn't even read the whole thing properly, you just looked at it, right? Because the UCAT is all about quick, smart decisions. One of the things you get to with experience, so something I get to as an emergency medicine doctor, having been working there for so many years, I can look at my waiting room and I can see just by looking at someone's face if someone really needs my help right there and then because they're so unwell. It happens rarely because like they've been triaged effectively earlier on, and then I just pick them out of the waiting room. I'm like, what's going on with this person, right? And that is a similar thing that you have to do with these questions. So we're going to end it here, and 80% of you guys said 2. So well done. Yes, 2 is a better one to start with, mainly because it's just shorter. It's less text, probably less steps for me to do. So I'm going to give you guys 30 seconds to do 2 first. Five seconds to go. And here's your poll. Go ahead and answer, please, for me. Right, we're going to stop you guys there. So quickly answer, because only 100 people have answered so far, which means you guys are a bit slow. Speed up. And right, I'm going to end the poll. Only half of you have answered, but anyways, so 50% have gone for B, right? And then we've got small percentages for other stuff. That's fine. Let's go with that. All right. So with quantitative reasoning, what you want to do is you want to start with a question first. Ignore the data because you don't know what you're looking for. Always start with a question. How much more does Rory spend per month on food, which is here, than gym? Okay, so let's figure out what food is. Food is 0.23, 23% of the total, which is 3,200. Okay, gym is 0.04 times by 3,200. Now you do that in your calculators, blah, blah, blah. It takes you ages. You get the numbers, then you subtract the numbers and you get 608. So well done for picking B. Can I get a thumbs up for those of you guys did it this way or were doing it this way? How many of you guys did it or were doing it this way? Now, quantitative reasoning is one of those sections. I absolutely love quantitative reasoning, right? Because quantitative reasoning is a section where there's multiple ways of doing the same question. However, some ways are so much faster. And a good example of that is my first ever student. One of my first ever students was my little brother, right? Who's actually a doctor now. That's how long it was ago. And he smashed quantitative reasoning because of the techniques I taught him. He got 890 out of 900, right? Based on little techniques like that. And one of those techniques is, why are we finding the difference at the end? Why don't we find the difference at the beginning? 23 and 4, we can do this in our head, right? So that's 19%. So 0.19 times by 3,200. One equation in your calculator gives you the same answer, 608, just in one go, right? So thumbs up who did it this way, who did it the second quicker way. And there's far less thumbs up than there were before, aren't there? Right? So well done those of you guys that did it the second way, you saved yourself 10 to 15 seconds. Now, 10 to 15 seconds may not seem like a lot, but let's say you save 10 seconds every question. 10 seconds times by 36 questions is 360 seconds, right? 360 seconds is 6 minutes. 30 seconds per question means that 6 minutes gives you additional time to do 12 more questions. That's a third of the exam. Just by saving 10 seconds, you give yourself extra time to do 12 questions. That's crazy. All right, let's try that. So now you've got time to go back to the harder question like we did, right? So let's go back to the harder question. And instead of 30 seconds, I'm going to give you like 40, right? 40 seconds for this one. Right, there's your poll because that's the end of time. So go ahead and answer if you manage to get an answer. And those of you who are like, oh my God, what is going on? There's mortgage budget, mortgage, rent, flat, property, but like what's going on, right? Confusing, isn't it? Okay. And that I can see is confusing because only a third of you have answered. And even the third of you have answered goes 20%, 23%, 34%, 13%, 9%. So you guys are all over the place, right? This kind of question, again, we start at the top. Remember, we triaged it the first time. We were like, nope, not doing it. And then you come back. You've got a little bit more time, so you can spend a little bit more time. Rory's mortgage budget includes a mortgage for 2 properties, a house and a flat. The mortgage for the flat is 6% of his monthly mortgage budget. So I don't know what's going on. So I'm gonna draw it out. So that's a quarter of a pie chart, which is representing this bit here. So, right, 6% of that is the flat. The rest of it is the house. Okay, so I've figured out 6 and therefore 19. The mortgage of his house, so the 19, is what percentage of his monthly mortgage budget? The monthly mortgage budget is 25, so 19 over 25. Once you identify the right numbers, then you can just do it on your calculator. So do 19 over 25 on your calculator or do it in your head, whatever you want to do. Correct answer is C. Okay, so well done those of you guys who got that right. But it's all about picking and choosing the right things and sometimes using your noteboard to identify the things you need to look at. Right, we're going to look at one more pie chart, make it a little bit different. For the purpose of the talk today, I've made it colorful, right? But remember, on the real test and also just in UCAT mocks and stuff, there's no color. So I'm only using color just to make it easy to explain. You guys have 30 seconds for this one. Right, guys, 3 seconds to go. Here's your poll. Go ahead and answer for me, please. And we're going to start reading through the question. So a lot of the information usually at the top is irrelevant. Okay, so ignore that and go straight to the question. Which attraction had the greatest rise in visitor numbers, i.e. which one had the biggest difference, right? Now, finally, we have a question where majority of you have gone for C. Okay, so we did well. Okay, so questions that are easier, and I know this is easy because the answers are words. In a math section, if the answers are words, this is an easy question. I should always do this, right? But I bet you some of you guys took ages and some of you guys actually did it a lot quicker. I'm not going to make you say it, but hang your heads in shame if you used a calculator for this. You should have never touched a calculator because that's just going to make you waste time. So a question like this, where I just need to know, I know the answers are words, right? I'm going to make it super simple. I'm not even going to look at the numbers. I'm just going to look at the first 2 numbers and I'm going to round them up or down. So this becomes 67 and this becomes 77. So the difference is 10, difference is 6, 17, 9, and 1. That's the biggest difference. Gray is closest. Closest is the right answer. That's how I would do it in real time, right? So question like this where the answers are words, I don't need to use proper maths. I can just roughly do things, and that's what I would do. And I just showed you in real time how quickly I would do it. And that's what I want you guys to do as well, right? Because they don't care. So unlike your GCSEs and your A-levels, they don't care how you do the working out. You just need to get the right answer, and that's it. Move on. And then you get a question like this. Thumbs up if you want to not do this question. Who wants to skip it, right? So if you get a question like that, immediately that makes you go like, whoa, what's going on, right? So this is a picture I took when I was doing some emergency trauma medicine in America. And something crazy happened in the emergency department, right? And then after we dealt with it and I was on break, I took this picture. and I'll tell you the story behind this picture at the course at a later date, right? But yeah, so if basically the whole point of the moral of the story is, if a question makes you go like that, guess your favorite option. Mine's always B. Flag that question and move on, and don't even turn around to look at it. Right, final section, situation judgment. Okay, we're going to go through this pretty quickly. Situation judgment is the one that doesn't get scored numerically. You get given a band, right? And this is a question where there's partial marks and it's a bit confusing, blah, blah, blah. But anyways, let's look at some questions. This is the ethics section. Now, you can have an amazing score, but then if you do rubbish in situation judgment and get band 4, you're probably going to get rejected from everywhere, right? So make sure you still focus on situation judgment. We're going to keep this super smooth and super quick. So I'm going to give you a few seconds just to read the scenario, and then we'll go through the questions together. Okay, guys, so for question 1, right, so the main issue here is confidentiality. There could be an accidental breach of confidentiality by Neil, right? So question 1, make a complaint to the consultant about Neil's social media post. What do you guys think? I'm going to give you a few seconds just to think about that, because the whole point is the situation judgment. You're going to spend your time reading the scenario, understanding the problem, but then the questions should only take you 10 seconds max. You make a snap judgment, right? So make a complaint, okay? One of the first things I want you to think about with these questions, you'll notice how for question 1 and question 2, the answers are the same, right? Because the answers generally stay the same. So it's like a very appropriate thing to do, thing to ask, thing to say, thing to, like, I don't know, think about. B is appropriate but not ideal. C is inappropriate but not awful. And D is very inappropriate thing to do. That always stays the same for these kind of questions. There's a few other kinds of questions, but for these ones, this stays the same. And you divide them in half, okay? This is good, this is bad. So first thing you want to do is think, making a complaint, is that a good thing or a bad thing in this situation? If you make a complaint, by the time you have a meeting with the consultant, you sit down, that post has been up there. Confidentiality has been breached for an extended period of time. Neil's going to hate you. The consultant's time has been wasted. The patient's confidentiality has already been breached. So it's actually a bad thing, right? So we're thinking C or D. Next question you want to ask yourself is, could any good come out of it? And in this case, there's too many cons. There's not that many pros. So the correct answer is D. A very inappropriate thing to do, right? What do we think about the second question? I'm going to get you guys to do the poll again. So relaunch the poll. Contact Neil, advising him to remove the social media post. You'll be like, Neil, man, like your post, I think it's bad. Just take it down. It's breach of confidentiality. So you just say that to Neil. What do we think about that? So 72% of you guys are going with A, and well done. Yeah. So first of all, is it a good thing? It is a good thing. So we're thinking A or B. Could anything really bad come out of this? Not really. You're supporting a friend. You've given them the advice based on what you think. Confidentiality has not been breached because he's just taken it down straight away. No time wasted. Happy days. All right, let's look at another scenario. I'm going to give you guys 20 seconds to read the scenario. Okie dokie. So this one is about basically your colleague Declan, who's not labeling the blood bottles correctly, and patient safety is being the main issue. Okay, that's being risked here. So tell Declan to ask the phlebotomist to do the bloods for his patients. What do we think about that one? Let me give you guys a poll. So basically get someone else to do it. Good or bad is what we're thinking initially. And this is great. So we've got 19%, 25%, 24%, 32%. You might as well just guess randomly, right? You guys are so all over the place. It's just like, so what I like to say, if I get my bars, if they look like this, right, that means you guys ain't got a clue. If they look like this, we know that A is the most popular choice, like the previous question, right? And you guys, like, it's a straightforward, easier question, or you guys are thinking on the right page. So what we want to do is we want to go from this as a class to this as a class, right? And that happens over time with the right guidance. So tell Declan to ask the phlebotomist. Getting someone else to do your work is a bad idea, right? The second question you ask yourself is, could some good come out of it? Yes, it could. At least the phlebs won't make the same mistake, right? So C is the correct answer. Well done to 24% of you guys who said C. And then finally, remind Declan of the importance of labeling blood bottles correctly. So be like, you really need to pay more attention because this could really affect someone seriously, right? And what do we think? Going to give you guys a few more seconds. Lovely. 92% of you guys are saying A, and well done. That is the correct answer. So we've just gone from that to, boom, this. Okay, so these are kind of, so thinking about those kind of things, asking you the first question, good or bad, and then asking the follow-up question is going to make life easy. Guys, well done for getting through that section of the UCAT. So we've finished the sample questions. What we're going to do now is very briefly for the next 5-10 minutes talk about how to prep for the UCAT, because this is important. And then we're going to touch on how to get the work experience tickets, and then we're done. All right. So give me another 10 minutes and then we're good. But I appreciate you guys must be exhausted from a day in school. You've had a long day. It's already close to 9 p.m., but we're going to be definitely done by 9 p.m. Okay. So hang in there. Right. So UCAT preparation. Now, this is a really cool picture. I don't know if you can tell, but I'm actually inside the helicopter. We were in South Africa, South African pilot, and we're doing a banked turn quite low with the lorry down there, you know, and whilst I'm taking this picture, because I was like, this is so cool, the pilot starts posing for the camera and I'm like, what are you doing? Eyes on the road, you know, fly the helicopter. Why are you posing for the camera? But no, it was a really, really cool experience. And yes, I know the 12 months are going to be challenging. The next 12 months, let's just think ahead. There's some awesome things waiting for you at medical or dental school. It's fantastic. I would happily do it all over again. Right. So how do you organize your UCAT prep? And this is the thing, right? So I know it's early days right now, but this is something that you need to start thinking about now, and therefore have the right resources as well, because this is not something your school's going to prep you for. What we're going to do is I always draw this graph, and on the y-axis, we're going to have your score, okay? And on the x-axis, we're going to have your time as time goes on. And this is what it looks like for most people. It's like a bell curve, right? So at the minute, you've not done much prep, you're going to be pretty rubbish. You'll slowly get better. And then it comes a point when you get to the top of the curve, and then you start falling off the curve. Now, what you want to do is you want to sit your exam at this point when you've done most of the prep, but you haven't burnt out yet, because this is the burnout stage. This is where you're just sick and tired of the UCAT. You never want to look at it again. You're not even putting in that effort anymore. You don't want to be here, right? And this point happens about 4 to 6 weeks into your prep. Now, some people are like, oh, what if I start doing prep now and go all the way to July? Don't do that. You'll be here, right? So you want to find the time, 4 to 6 weeks block in your summer holidays or whatever. Make sure that you're not going away. There's no big distractions. Or if you are going away, you know, you have time to prep whilst you're away or whatever it is. You need to pick a 4 to 6 week block, looking at your calendar, have a chat with your parents when that's going to be, and then kind of work backwards 4 to 6 weeks. That's when you want to start your prep. And that's the date that you want to book your course, right? Now, if you spend too long, you're going to, like I said, get sick and tired of it. You're going to burn out. If you don't spend enough time, you'll get a lower score. So we want to be here, okay? Now, you can move your entire curve up by using the right resources. So whatever you were capable of getting, use the right resources, you'll get even more. You'll get even better because you'll know more techniques. You would have practiced with those techniques and so on. So the way we want to split your 4 to 6 weeks worth of prep up is in these 3 sections. The first 2 weeks is all about accuracy. You want to understand the types of questions. You want to understand all the different techniques. And the best way you can do that is by coming to our course, or what we're doing as well is our series. I'll tell you about that in a second. You want to do short quizzes. You want to do a bit of untimed practice and also a bit of timed practice. You want to be aiming for no more than 1 mock a week, and you want to focus on your weaknesses. Okay. So if you identify that verbal reasoning is your weakness, do more of it, right? So try and understand why it's your weakness. Try and understand where you could improve. Once you've understood the questions, you know every single type of question that could come your way. You know how to identify them. You've got good with triaging. Okay. You've got good with identifying the broken ankle, the sprained ankles versus the heart attacks. Okay. Then you start working on getting quicker. So that's when you start identifying even quicker ways of doing the questions, right? Being super speedy, triaging even more effectively. And that's where you practice more of your triaging. So picking and choosing the right questions. You do longer quizzes, so you get a chance to do that. You do 1 or 2 full mocks a week. Now, we've got a question bank where we give you 10 mocks. There's an official question bank as well, the official UCAT question banks that only give you 4 questions, 4 mocks. Don't waste them at the beginning, okay? Keep those for towards the middle and the end. And you want to start focusing on your strengths, because the example I gave you of my little brother who got 890 in quantitative reasoning, he knew that was his strength. He knew verbal reasoning was his weakness. So he focused more on his strength, got that even better, and ended up getting in the first SL. And then the final 2 weeks, make sure the night before you relax, you want to do longer quizzes, continue doing those, make sure you know exactly where you're going, you've got all your documents and so on, and then you've done some more mocks as well. So that's how you want to go about it. Make a timetable. Students who do well, make a timetable. So let's say this is a random timetable. We are on a Tuesday. Your exam is in 1, 2, 3, 4, 5, 6 weeks. So that's the exam on a Friday. So let's say we're going to do mocks on Fridays. Okay. In weeks 3 and 4, onwards, we're going to do 2 mocks. And every time we do a mock, we do a review the next day. Okay. And so on. Maybe it's your birthday on that day. Block that out. Maybe you're going to go to the cinema, see like something in that evening of your friends. Make a proper timetable. Okay. And I'm going to email you guys at a later date a timetable platform that you can use, or you can get it off the UCAT website as well if you want. So here's the resources that you can use from the Medic Life, right? So there's two things that we're doing for you guys, which are going to be super, super helpful. The first one is our 2-day live online crash course, basically. So it's like this, but much smaller group, not 600 of you, more like 50, 60 of you guys. It's going to be like a classroom virtually. It's going to be live. It's going to be taught by myself. And we're going to do what we just did, but for 2 days, right? So verbal reasoning, 2.5 hours, decision making, 2.5 hours, and so on. So lots of stuff on it. You learn all the techniques. You master how to triage. You learn every single question. Then we're going to give you our Q bank if you want the Q bank as well. So that's 7,000 questions with 10 mocks. Now we've identified no one does more than 4,000 or 5,000 questions. So you'll come across other organizations that are giving you like 20,000, 30,000 questions. You don't need that. No one does more than 4,000 or 5,000. So we focus more on the quality of our questions. 7,000 questions, 10 mocks. That's what you need. And then you get a guaranteed slot on our work experience program. So like I said, the work experience workshop next Sunday has got 3,300 people registered for it. We've only got 300 seats. If you want to do the UCAT course, half of those seats we're giving to people who just come to our course. So the first 150 who get the course, they'll get a guaranteed spot. And the remaining 150 seats, they're going to be open to the 3,300 people to fight for, like a concert ticket, basically. So that's the first thing. We understand that some people will just work better as a crash course. We also understand because over the years, people have said, you know what, I want to do slower, longer prep. So what we're doing is we've also got the UCAT series. It's the same price, same content, but rather than doing it over a weekend, we're going to do it over a month. So just like tonight, Wednesday evenings, we're going to do Wednesday evenings for a whole month. And we're going to go like every Wednesday evening, we're going to spend like 2-3 hours on it for a whole month. We're going to do it in June, and then we're going to do it in July as well. So you can pick whichever one you want. You're going to learn the same techniques, but over a longer period of time. So you can ask those questions to us. If you have any more questions, you do a bit of a session with us, you go and do a prep, you come back, you do a session, do prep. You can still get the question bank as well if you want. And unlike other organizations that charge stupid amounts of money per week, we just charge you one amount and you get the Q bank for the whole time from May till October, rather than paying for a weekly, which ends up being very expensive. And you still get a work experience workshop and personal statement workshops guaranteed with that as well, right? So a little bit of feedback. The main thing with our course, kind of like how you feel right now, right? Hopefully you've got a better understanding of what UCAT is, how to deal with it. But people before the course don't feel very confident. 2 days later, during the course, they feel a lot more confident about the UCAT. They know what they're dealing with. They're no longer scared. They appreciate what they need to do, and they just go and smash it, right? That's the whole point. A little bit of feedback. This is just some feedback from just one course, right? We run loads of these again and again. So, new things, the amount of things that someone learns. So you may think you're already good at it, but just what you're going to learn is going to be way more. I'm going to give you 10 years of my teaching experience with the UCAT. Just going to impart that knowledge onto you. It's very interactive. Okay, so there's a lot of interaction. Unlike today, I know there was not a lot of interaction, but there's going to be a lot more interactions. There's strategies that we're going to take you through, analysis of each and every single section, all the different question types. So every single question type we're going to go through, right? Detailed explanations. It's engaging. It's interactive, and hopefully today, I made it a little bit fun for you as well, right? That's the whole point, because UCAT prep is boring, so I want to make it fun for you, and just how fun it is, essentially. Breaks, it's going to keep you guys motivated, lots of different techniques and blah, blah, blah. So how many courses are we running? What options you've got? How much is in? Blah, blah, blah. Well, there's two things. Like I said, the UCAT series, which is the Wednesday evenings, we're going to run it once in June and once in July. So you pick if you want the June one or the July one. And then if you want the weekend courses, we've got 6 courses this year. They're likely to sell out. So if you want one, get one early based on whenever you think you're going to sit the exam. So if you're going to sit the exam in July, pick these 2. If you're going to sit it in August, pick these 2. If you're going to sit it in September, you shouldn't be. But if you are going to sit it in September or late August, then pick these 2, right? One of the 2. So those are the dates. Now, if you buy a question bank from another organization for like, I don't know, for 6 weeks, which is what you need, you're looking at spending about 60 to 70 pounds, right? However, our Q banks are a lot more affordable, but what makes it really, really good is the course. So you're looking at a few £100s at other organizations. So our our course is £99 for the 2 days. That's like £8 per hour of tutoring. So that's a course. If you get it with the bundle, so with the Q bank, it's £129. Okay, so that's the 2-day course or the 1 month UCAT series with the question bank as well. It's £129. And just for the next few days, and until we do the work experience workshop, until the 150 spaces are taken up, we're doing a £20 discount. So this actually becomes 109. Only applies to the bundle, okay? Doesn't apply to the course only. So if you're getting the Q Bank as well, it becomes 109. You get the Q Bank, the course, and a guaranteed space on our work experience program for 109. So when you get to the checkout, please put in the discount code WEX26. So work experience 2026. So 26, £20 off. And that'll make your £129 course 109. Oh, and the best thing, we're the only ones that give a money back guarantee. So if you don't get any interviews because you got rubbish UCAS score or whatever, we'll just refund you the entire amount because we don't care about your money. We actually care about getting you in, which is what a lot of other organizations will never do. I don't know why. I'll leave that with you. So yeah, so as simple as that. If you do our courses, you come to our strategic application workshop, which is a free thing that we're going to offer you if you're on the course, because that's the whole point. We're going to help you pick the right unis. You do our course, you pick the right unis, and you still don't get any interviews, you can have your money back. I don't want it. Simple as that. Right. So this is the QR code if you want to go ahead and book it. Like I said, the first 150 out of 600-ish of you guys that were here today are going to get a guaranteed spot. So be quick. Otherwise, you're going to have to fight everyone else, the 3,000 people that are waiting to get tickets next week. So remember the WEX26 code. You can use that here. For those of you who want a little bit more guidance and prefer something more one-to-one, we also have the Ultimate Admissions Package. This is on our website. You can use the QR code at the bottom to go there. This is a more extensive program where you still get the work experience workshop. Instead of doing a course, you get 10 hours of one-to-one tutoring. You still get the QBank. You get a recorded version of the course as well. Then you get a few additional things which are optional add-ons if you want, including the interview course, one-to-one guidance on which units to pick, for example, and in-person A&E and GP experience days as well, right? So there's options there. If you want that, this is via application only. So we don't just give it to everyone. You have an interview with me first, where we decide if you're the right person for us, and also what would be the right thing for you. A little bit more expensive because it's all one-to-one. A lot of meetings with me, for example. And if you are interested in something like that, you can use the QR code. You can book a free meeting with me over the next few days. Bring a parent along, please, because you have to bring a parent along so we can all 3 of us or 4 of us can chat together to find out what's best for you. And that is a free meeting you can book with me over the next few days, and we can talk through it if you want. Otherwise, if you want to go with just the UCAT course option, by all means, go for that. And the last thing, like I mentioned before, this is something that is very close to our hearts. And I told you guys about my little brother, not my little brothers, my brothers. So I've got 1 older brother, 2 younger than me. This is all of us as babies, and this is us now as doctors. But we all come from a widening access background, which is what the Medic Life is all about, right? We make our courses as affordable as we can, but despite that, we still offer the Medic Life bursary. So you get the Medic Life bursary if you've got a household income of 20,000 or less, or you've got extenuating circumstances. Go check out the bursary page on our website so you can apply for the bursary. You get £50 off the course, essentially, if you meet our bursary criteria. We ask for some evidence once we send that through. However, if you do meet that criteria, please don't wait, because the courses are going to go, the work experience workshops tickets are going to go. It takes us about up to 2 weeks worth of working days to get through the bursary stuff. So it can take a while. So just go book it and we'll refund you the £50 if you meet the criteria, which is very straightforward and clear, right? So that's one thing. And then the final thing, we have a scholarship as well. So this is a picture of me. This is me right there with a lot more hair than I have now. My older brother and then my dad. So my dad was an orthopedic surgeon. He passed away in 2002, maybe even before a lot of you guys were born, right? He was an orthopedic surgeon and he was a victim of religious hate crime, right? In Pakistan, which is why we moved to the UK, became doctors, and so we've all become doctors now. The point is that I want to start a scholarship in his name, and we're going to do a fully funded application for one of you guys. Every year we pick one person, and we basically give you everything for free. You get UCAT stuff for free, interview stuff for free. I've got 3 brothers, we're all doctors. We give you lifelong career advice. You basically become part of this scholarship holder community where every year only one person gets it. And you basically stay in touch with us. And the point is that even when you become doctors and surgeons or whatever you become, you'll be part of this group that had the scholarship, right? So there's something meaningful that we're trying to do. And just to give you a bit of an idea as to why the Medic Life is so important to us. So the requirements for that are a little bit difficult. Okay, so the bursary, anyone can apply. If you have a household income below 20K, anyone can apply and you get £50 off. The scholarship, there's a stricter criteria for that. Has to be medics. I'm afraid, dentists. I do apologize. You have to send us a CV with your GCSE results on it and proof of those results. You need to give us a cover letter, maximum 400 words, as to why this scholarship would be beneficial for you. So we're looking for people with extenuating circumstances who've come through hardship and a household income of below 20K. The deadline for that is in about 2 and a bit months' time. So you got a bit of time, right? The bursary, anyone can apply at any point, but the scholarship, only one person gets. And that's got like an interview process to it. It's a bit stricter. But yeah, there's a lot to it, but we're 4 minutes away from the deadline. So final thing is our interview course, just to let you guys know as well, the interview courses that we run in winter. So you guys are going to be thinking about this in winter. The reason I'm telling you now is because these are so popular, they sell out months in advance, but we give 24 hours early access to anyone on the UCAT course, right? As we do with the work experience workshop. So guys, that brings us to the end of the talk. Now, thank you so much for staying for almost 2 hours of a lot of stuff. We've gone through a lot of information. Like I said, thank you for coming here today. For those of you who are going to come back for our course or the work experience workshop and other stuff, I would love to meet you guys in person as well. That'd be great. But those of you who are sick, who are just exhausted and you want to go to sleep, go for it. But I'm going to stick around for the next 20 minutes. If you have any questions, go onto the Medic Life Instagram page, put it into the story. If you want to book the course, make sure you do that ASAP. WEX26 is a discount code for £20 off the bundle only. You don't get £20 off if you're just booking the course. We've got the link tree for all the different links, and then the Instagram broadcast channel as well. For those of you who don't want to buy the course because you're like, you know what, you'll just deal with the free stuff, which is totally fine, and you still want to come along to the Work Experience Workshop, half of the tickets I'm going to hold for the 3,300 people who've signed up. They're going to go live on our website on the 19th of Feb. So that's next Friday at 6 p.m. Last year when I did that, they went in under 60 seconds because there's 3,000 people who want them. There's only 150 of them. The ratio for medicine and dentistry is like 1 in 8. The competition ratio for our work experience workshop is 1 in 20. So our work experience workshop is actually even more popular than medicine and dentistry in itself. So like I said, so if you want to guarantee to want it, get the course. If you want to try your luck and try your chances, I apologize in advance. It is a 1 in 20 competition ratio. You probably won't get it, but give it a go. And yeah, I'd love to see you guys in person next Sunday, where we're going to have an awesome work experience workshop for you guys. But guys, thank you so much for today, for coming. And I hope you enjoyed the 2 hours. It's gone by pretty quick, hasn't it? So what I'm going to do is I'm going to give you guys a few seconds for those of you who want to go and book a course or something to go and do that. I'm going to take a quick toilet break, and then I'm going to come back and we're going to do a 20-minute Q&A until 9:15 or something like that. So if you want to stick around for the Q&A, stay in this meeting. Otherwise, I will see you, hopefully, fingers crossed, next Sunday at the workshop. All the best with your applications, and see you guys soon. Take care.